Dr. Christy Ennis. I absolutely love when people want to exercise on their own because that's a way to build strength all the time. However, I often see some very common exercises people do incorrectly, which can actually lead to injury, totally counter to what we want to do, which is strengthen. So I'm going to go over those common mistakes that I see and how to improve and continue to get strong. Exercise number 1 is the squat. Great exercise to do. You can do it body weight without any equipment and get some really good benefit out of it. However, I often see some things go wrong here, and I am not the best demonstrator because of some of the reasons that you guys will have too. If you've got tight ankles, tight hips, weakness anywhere in here, back issues, you're going to tend to compensate in some way, shape, or form. So a lot of times what I see is people come down and they'll go right onto those toes. It's a little bit of an exaggeration. Instead of sitting back onto those heels to engage in through those glutes a little bit more. A lot of times we have weakness in those glutes, so it's easier to go forward like this. The other common mistake that I see is those knees going together, right? So if you've got any weakness on the outside of those hips, that's going to happen pretty easily. And again, exaggeration, obviously, right? Oftentimes, too, people can't get down very far, and to help them get down, they'll bend right forward. Again, coming from that spine or an arch in that spine as they come down as well. So now I'm going to show you some ways to help maybe counteract that with just a little bit of a tweak into this exercise. Couple variations to help you out. One is using a chair, make sure it is sturdy. But if you think about going to sit down, which of course we all do, you're going to think about shifting your butt back, right, in order to get down to that chair. So goal would be to barely touch that butt and come back up. But if you're beginning and having a little bit of a struggle, it is okay to kind of rest, pause for a minute, and think about what you're doing. To make it a little bit easier still, you can certainly use your hands to help you out a little bit if you press down into your legs. If your chair happens to have arms, that's even an easier way to go about doing this one. And I would shoot for about 15 to 20. Another modification to help get that proper form is going to use a counter or something nice and sturdy like a table, or if you happen to have a bar screwed into your wall like I do, that clearly works as well. You're going to lightly hang on to that bar, and then it's just a little sit back. So I'm shifting my weight towards my heels. I had a patient say it's like you're going to shut a drawer with your butt. That's exactly what you're doing. But you're trying not to pull yourself up with this bar. If you want a little extra oomph and really work the outside of those hips a little bit more and help so that your knees don't collapse inwards, if you take a band above the knees and gently pull out as you come on down, you're going to help gain, like I said, some activation of those outside hip muscles. And oftentimes, if there's any pain, this helps with that pain as well. Again, shoot for about 15 to 20. Exercise number 2 is a lunge, and it's great for quads and glutes. Ooh, got band marks from the last exercise. So we're also going to do today a reverse lunge. So if you have any knee pain, oftentimes a forward lunge, again, one of the things that I see people do a lot, could cause a little bit more pain. Not everybody, but just keep that in mind. You know, if you have knee pain, that tends to be a little bit more uncomfortable. So the other common things that I see are people just trying to rush through this and get it done, right? So that we can just be done. And so I'll see this a lot. So you're not doing a whole lot here, except probably getting your heart rate up. So I guess you're doing something. The other common thing that I see is that when people do this, they kind of lean their body forward. So again, not using this leg as much as you can. And lastly, a lot of times, again, right, this is a tough balance one. So people kind of be wobbly a little bit all over the place. Exaggeration again. So there are some ways to help improve this one, of course, as well. To help with some of the common issues that I see with the lunge, step 1 is actually grabbing onto something that will help keep you steady. It is totally okay to use something to help your balance if that helps you keep good form, which will also help then activate the muscles we want to. So if you've got that bar again, if not, a counter or even just the wall, the dowel if you happen to have that too. But we're going to start by going into, again, that reverse lunge. And besides the balance and wobbliness, the other common things that I see that this can help with are coming straight down. So if you remember, I said a lot of people lean forward. Part of that problem is that people will keep that back heel down because their balance is very wobbly if they have that heel up. So if you've got this to hang on to, that helps eliminate that. So you're gonna step back really right to those toes, and you're literally dropping that body straight down. So it's not here unless you're trying to stretch. It's truly straight down. If you cannot get down super duper far, don't worry about it. As long as you've got the right form, pay attention to how it feels in your body. This front leg is really doing most of the work, and it's okay wherever you're at to start with. So remember, heel up, straight down, shifting kind of so this front leg is doing more of the work. This hanging on also eliminates, sometimes I'll see people, again, just like the squat, bring that knee inwards, and you can focus a little bit more on really keeping things nice and aligned. Now, if this is still too much on your knees or any other body part, I'm going to show you another alternative as well. Okay, for this next kind of modification, you can still use this bar to help out, but I've got an old textbook anatomy. You can see that that is well loved and well worn. So whatever you've got handy, if you're as old as I am, maybe the Encyclopedia Britannica, if you've got those lying around still. But if you need it modified even a little bit more, the higher you go, the easier it is. So just keep that in mind. Phone book sometimes works too. But so you'll start with same leg, right? Kind of on that book, or you could use a step too. And then the same idea, we're gonna lunge down, but this book actually gives us a little support, so it even puts a little bit less pressure onto that knee. And again, the back knee even as well. Sometimes that's the knee that gets a little bit irritated. So if you go, oh, this isn't quite the right height, like I said, just go up a little bit and that will even put less pressure on. Same concept for any of these variations, 15 to 20 as long as it feels good. Next exercise is on the ground or on the bed. Just remember, you don't have to get onto the ground if it's not comfortable for you. And this is for the side of the hip again, one of my all-time favorite exercises, but one that I see go incorrect a fair amount actually. So first things first, you want to make sure that you are rolled directly on your hip. So a lot of times I'll see people kind of rolled backwards, and then you're not going to use the muscles in the same way. Second thing that I often see is that people have their legs way too far forward. Then you're going to use more of your hip flexor than actually the side of that leg. So I always tell people is when you look down, you should see your toes, maybe your feet. But if you see anything more than that, you typically have your legs too far forward. For this next part, doesn't matter whether you have your your bottom leg bent or straight. Either one is totally fine. I like to have it bent because then that helps me. Again, if my hip starts to shift forward, tongue twister there, I know that I really want to aim for this back heel, okay? So pay attention to this one as you are lifting. If you feel like you're in the right position, but you really feel it in the front, just know that you'll have to bring that leg back a little bit more, all right? The other thing I see is people tend to kind of collapse onto their side, and you do want to have a little bit of space. If you followed me, you know that I always say leave room for your cupcake, not to smush it. And then lastly, when you're lifting, like I said, besides letting that leg come forward, this is just a little bit of a tweak to isolate those muscles a little bit more. But if you can turn those toes down, again, always using pain as a guideline, right? If it hurts to do that, just keep them pointing forward, no problem with that. But that again adds a little bit more of a isolation into these side muscles here. And same concept, 15 to 20, as long as that feels tolerable. Last one, again, on the ground, or feel free to stay right in bed, is the bridge, right? So that's lifting those hips up, engaging in through those hamstrings and glutes. Again, another one of my favorites, but oftentimes I see some things go a little bit wrong. Here's the most common things. Number one is that people lift up way beyond where their body wants to be. So if you can see me lifting, I've got an arch in through the lower part of the spine and even in through the rib cage. So goal would be when you're doing this, we'll correct this as we go, is only lift up as high as you go, keeping a nice flat spine in both the lower spine and that rib cage. So you really want to think about pressing those hips up. That helps a little bit to keep that spine neutral. And it's okay if you don't lift super duper high either, okay? So number two that I often see is that sometimes it's hard to lift because those hips are so darn tight. I happen to be one of those people sometimes. So a way to help fix this is putting those heels together and turning those toes out. Just opens up that hip space a little bit. And then you can go ahead and lift, and you should find that actually you sometimes even feel a little bit more engagement through those glutes, and that it does really help to open things up. Lastly, I oftentimes see people kind of straining with their neck, right? So they'll push that head down, lift up so that they can help themselves. It's not really helping, but so that it feels like you're helping yourself get a little bit more motion, and and oftentimes those shoulders come forward. So simple, not easy, simple solution for this is just really make sure you take some nice diaphragm breaths before you even start, and concentrate on relaxing and focusing, putting your energy right into that bridge. That way you're not stressing any of that other area of the body. And again, shoot for 15 to 20 reps here. One last thing that I often hear people say is that their hamstrings will start to cramp. So there's a couple ways that you can help work on that. Number one is, like I said before, really focusing your energy in through this lower body. And you can really do a little extra glute squeeze before you even lift up. Helps to put more of that emphasis in through the glutes versus the hamstrings. And then also, if you're still struggling a little bit, if you think about kind of shifting and pushing down a little bit more into your heels, sometimes even lifting the toes up, that can help if you're just starting out with this bridge to help those hamstrings not cramp up.